Now, if you are in North Carolina or you know someone who is in North Carolina, encourage you to consider being part of FRC Action's School Board Boot Camp. You know that school boards matter and we need good people on the school boards. Well, we are going to be in North Carolina helping people do just that. I will be there as well. Lots of other good friends will be there. Wednesday, February 9th, we will be in Raleigh, and on Thursday, February 10th, in Charlotte. For more information and to register, check out frcaction.org/schools. That's frcaction.org/schools. Even if you're not in North Carolina, you can go there for our online tools and resources to help you be part of the school board nearest you. Again, that's frcaction.org/schools. Last month, the United States Supreme Court issued mixed rulings in cases challenging two of the Biden administration's COVID shot requirements. They allowed the mandate for certain healthcare workers to go into effect while blocking enforcement of a shots or tests rule for large businesses. Well, AFA Action, a division of the American Family Association, is petitioning the court to revisit the decision and hear the case again. And they're inviting people to sign their petition for the Supreme Court to reconsider the case. Here with me now to talk about this is Walker Wildmon. He's the Chief Executive Officer of AFA Action, Vice President of Operations, and Public Policy Analyst at the American Family Association. Walker, welcome to Washington Watch.
So glad to be with you today and appreciate the work you do at FRC.
Well, we appreciate your work as well. Thank you so much for taking the time. Tell us, what's your biggest concern about the court's decision to uphold the vaccine mandate on healthcare workers?
Well, the ruling here really is built on two falsehoods, two main falsehoods, and they're both very important. The first one is that we don't believe that the Department of Health and Human Services, we don't believe the Biden administration has the legal authority to require a shot or an injection for all healthcare workers across the entire country. We don't believe that the executive branch has the unilateral authority to do such. So that's the first premise that's more built in the law and the Constitution. The second issue here, which can't be overlooked, is that the Supreme Court issued this ruling based on this statement that they included in the ruling. Here's what the ruling said. The Secretary of Health and Human Services determined that a COVID-19 vaccine mandate will, quote, substantially reduce the likelihood that healthcare workers will contract the virus and transmit it to their patients. Well, that's not true. That's not how the shots have been working. As the CDC director and others have said, if you get the shot or the COVID-19 vaccine, as some are calling it, you can still contract COVID and you can still spread COVID. So the entire basis of the executive order, the entire basis of the Supreme Court ruling is built on a medical and scientific falsehood that these shots prevent transmission.
Walker, what impact has this mandate been having on the healthcare community?
Well, it's been having a very devastating impact on healthcare workers. I mean, these are people, men and women on the front lines that are day in and day out working, 50, 60, 70 hours a week to serve patients in hospital systems and medical systems. And this has forced many of them out. I mean, many of them don't want to participate in what is still an experiment. I mean, this is still in the experimental phase. Clinical trials are still ongoing. There are a lot of questions about these injections that we just don't know about yet because they've been rolled out in a very fast manner. So people have had to either quit or be fired in a time where we need healthcare workers. I mean, we're at a time in our country where we need all the healthcare workers possible to fill the slots that we have all across the country. And there was even a story out in California where they fired so many healthcare workers for not wanting to get the experimental shot that they were allowing COVID positive sick nurses to come work in the hospital. And so it's just completely absurd. And we need to be appreciating our healthcare workers and not firing them because they don't want to do this.
Yeah, that is one of the many strange developments out of all of this is if you're healthy and haven't been vaccinated, you may not come to work. But if you're sick and have been vaccinated, you may come to work. It doesn't seem to be based in what's best for public policy. What are you asking people to do?
Well, our petition right now is to the Supreme Court. So we're asking people to go to afaaction.net, sign the petition to the Supreme Court for them to reconsider this case, because the way they ruled on this case, and this is a little bit in the weeds, but you and the folks at FRC probably understand this, but the way they ruled, they didn't definitively end this discussion. They did rule in favor of the Biden administration on the healthcare worker mandate, which is what we're talking about here. But they left a door open, maybe a small door, but they left a door open for this to be relitigated and come back to the Supreme Court. So we're trying to influence the Supreme Court to change their mind on this, and should this come back up before them, to rule a different way.
We got about 30 seconds, but when will this end if the Supreme Court doesn't revisit it?
Well, I think this is going to have to be handled at the state level. I mean, the shots have always been, and vaccines have always been a state issue. They've been in state law, state healthcare policy. Rarely or ever has the U.S. government mandated something across all 50 states. So this is very unusual, and we're either going to have another case be litigated up to the Supreme Court or a new president, and that's 3 years out. So we need another case to make its way through the federal system and back to the Supreme Court so that this can be ruled illegal and unconstitutional.
Walker Wildmon, thanks so much for your time. Appreciate it.
Thank you.